So, very good morning, good afternoon, and good evening, one and all. We can start our today's session, 291st uninterrupted Zoom webinar. So, today, the same subject we are discussing, what needs to be done to make homeopathy is the number one medicine in the world. So, we can start with a short video. Abel.
World over, health is at stake. Homeopathy.
So we are today's 291st day. It's an uninterrupted Zoom webinar. So we have three panelists today. Dr. Iris Vaughan Houston from Chile and Dr. Hiralal H. Agarwal from India, Dr. Amir Nasir Malik from Pakistan. The subject is same, what needs to be done to make homeopathy is the number one medicine in the world. So each panelist have 10 minutes each, and after that we are going for the discussion. So I will call Dr. Iris from Chile. He has trained and practiced as a homeopathic doctor from the outset of her medical career and studied and wrote her thesis on the early practice of its founder, Dr. Samuel Hahnemann, achieving PhD degree from the University in Hanover, Germany. She has worked for the past 20 years as a practitioner and an active promoter of homeopathy in the public health service. Wait. And she directed for 10 years the homeopathy unit in one of San Diego's biggest public hospitals, the San Juan de Dios. In addition, she runs her own practice. She also carries out research and lectures and presents papers both nationally and internationally on her topics, which include the use of meditation and relaxation techniques and fluorescence therapy. Great. She has worked to develop interest and use of these techniques among nurses and doctors working with cancer and HIV AIDS patients, as well as with other serious illness. Born and brought up in Germany, she has lived and worked in Chile since the late 1990s. So I would like to call Dr. Iris on behalf of Ifph. Warm welcome, Doctor. You can speak 10 minutes.
Thank you very much. Thank you very much for the invitation and to give another point of view of how we can create together to make homeopathy the number one medicine in the world. I want to share the following thoughts on these subjects. First, what we need to comprehend. Each era, each historic moment in humanity has its medicine. We have the Ayurvedic medicine, the Egyptian medicine, very ancient medicine, which developed according to a high development of society. Then the Chinese medicine, which was created in a flowering moment of a Chinese culture. The Greek medicine, where Hippocrates made a three-level way of healing. First, when a person fell ill, he made nutritional dietetic adjustments. If the person didn't get better, he gave medicine, herbs. If then the person didn't get better, he sent them to the temple, to the sacred place. So he had to establish a dialogue with the gods, what he needs to adjust in his life to get better and get rid of his illness. And this three-level medicine, although in the Western world you say we do Greek medicine, this third level has been lost. But the ancient Greek did it this way. Then we have the time of the medieval medicine, where instead of seeing God as in the Greek comprehension, God was something we have to fear, the divinity, life is awful, and so we have to fight against illness. It was the logic of fighting and getting the impurity out of the body, because the body was impure. So there was all the logic with blood drainage, with putrefacients, amputations. Afterwards, we get to the period of the Renaissance and in the 17th and 18th century, of the understanding of vital force and in understanding the human body. And this took two large ways. One, the development of the Newton line of thinking, that the body is a machine, the mechanism, and a second line of thoughts with various scientists and the vitalism, and there's part the homeopathy. So what we need to comprehend, that each area of humanity has its medicine according to the consciousness of the time being. So understanding this, in what I wanted to share with you is, in order to make homeopathic #1 medicine, we need to change our consciousness. We need to strengthen our consciousness of what we really do as homeopathic doctors and integrate a broader spectrum of society, because it's a movement of society. It's not just of the doctors. And the big question is how to do this from this comprehension on. And I want to share my reflections on it. If you see, this is a scale of a picture, a diagram from an organization which is oriented to promote well-being in humanity. And they state here Ayurveda, traditional medicine, ancient Greek medicine, homeopathy, hydrotherapy, chiropractic, the Flexner report, organic farming, high wellness, first wellness center, wellness goes mainstream. Then the motion that happiness is part of human life, getting the World Happiness Report 2012. And I want to point out the organic farming, because I think this is one of the important things homeopathy has to take care of. Can we take for granted that pulsatilla, our pure materia prima, is really protected? Do we have good pulsatilla growing in nature? So that homeopaths start to care about the origin of the remedies and go beyond of disease and eliminate disease, with getting a step further, because this is an impulse of our society to start to create happiness, well-being. So I think these two aspects are important to consider if we want to improve the development of homeopathic medicine. Because homeopathic medicine is a vibrational medicine, and it takes the pharmacological level of the substance to get the inherent power of the vital force in the substance to the surrounding. But as we know, the law of similar is a law of nature, and it's not restricted to the use of homeopathy. So we, as a homeopathic doctor, have to live the law of similars, which means to live the law of vibration. That means that my purity and my personal development as a human person is important to be able to attend with the best vibrational level of my consciousness, the person I want to help. Having said this, each person, we need to understand in his physical situation, his mental and his social integration, and the harmony of this integration means health. In this has an interaction, a cultural interaction, a biotic interaction with what he eats, the nutritional aspect, also how we live in nature, and the biophysical interaction, how we relate with sun, water, earth, and air in our nature space. When we take these aspects in account, I propose that to make homeopathy the #1 medicine, we have, as homeopathic doctors, take care of nature. We cannot say it's not important for us. Taking care of the purity of the origin of our medicine. Secondly, taking care of social well-being, especially of families, because one person is always part of a family, and his interaction in the family, which is his first environment, is important to reestablish health. I have treated many HIV and cancer patients, and it is really astonishing how it is clear that when one member of the family has one of these diagnoses, the entire family gets ill in some way or another. So we have to take care of this aspect. Thirdly, understand that health is a conscious process. This means it is beyond the mere homeopathic medicine. We cannot pretend that the solely administration of Arsenicum album C30 we establish perfect health. It is very important, but it's not the only mean. But as we are homeopathic doctors, we understand the vibration of Arsenicum album. That means there are many fears which have created an egoistical, selfish attitude. So we have to show the person how he can change in this process with his conscious will to take the energy of Arsenicum album and make personal changes in growing in confidence and really open up to receive and to give and interact with people, for example. So I think as homeopathic doctors, we have to open up to make homeopathy and the comprehension, the broad comprehension of nature, which means our materia medica, that we understand that each remedy is a vital force in its own, which we need to integrate to establish health. This line of vital force we can take as a conscious process and develop tools, concrete tools for the patients to improve their well-being and their health. So this way, making a much broader use of the huge knowledge homeopathy provides, because Hahnemann gave us a new way of study nature, of study vibration, and to make it methodologically accessible as a tool. This is something never seen before. So that we really use the tool in all what it can offer. And this, I think, is a collective development. So as homeopath, what I suggest, we need to integrate organic farming, protection of nature, social and cultural understanding, psychologists, complementary tools, led and driven by the head, due to this broad understanding of what Hahnemann gave us, the homeopathic physician. These are the thoughts I wanted to share with you, and I hope it gives an impulse for our discussion. Many thanks.
Thank you, Doctor. It was really nice discussion and nice presentation. We want to discuss more about it when we are in the discussion on time. So I would like to call the second panelist, Dr. Hiralal H. Agarwal from India. He's a graduate from Pune and diplomat from the International Academy of Classical Homeopathy, Greece. Great. Director, Sriram Homeopathy Clinic and Research Center, last 40 years. Teaching experience of 30 years in Materia Medica department. Appointed as a visiting faculty, Hahnemann College of Homeopathy, UK in 2019. A regional representative of India, West of World Health Awareness Organization, USA, 2016. Secretary of World Federation of Alternative Medicine, WFAM, Solapur, Maharashtra, in 2002. Presented national and international papers, conducted campus and have 2 free projects on 50 senior citizens and the other slow learners. HIS goal are to raise awareness of homeopathy, foster its growth, educate the public and the homeopathy community, and to reach out to individuals who can benefit. It is dedicated to improving health through the advancement of homeopathy, serving the undiverse and those who have served. Great. Great. Welcome, Dr. Hiralal, on behalf of Ifph. You can discuss. So before that, I just want to ask a question. In United Kingdom, there are a lot of homeopathy colleges, right?
Yes.
Yeah. But homeopathy is not, they are
Internet
not.
connection. Pardon me?
Can you hear me, sir? Yeah. In UK, there are a lot of homeopathy colleges, right?
Yes.
But homeopathy is, the system is not approved there. Am I right?
It has been not approved by the government officially, but it has a good patronage by the king. So things are still moving. There are few colleges which are still running. When I was in Manchester in 1988, there were colleges. I had also met Dr. Peter Fisher in 1988 at the Royal England Hospital, where there was a big children's hospital. So a good patronage by the king has been given. King Edward is still a very good founder and a lover of homeopathy. Though the whole world is against it, in UK still you have a good homeopathy. But the problem with the whole world, apart from India, this is the best part, that in all the Western countries, homeopathy is not used as a medicine or medicine for treating illnesses, any sort of illnesses. It is only India, because when I've learned in Greece from 1996 to 2000, I had been with various countries throughout, and we are seeing that India is the only country where you can use homeopathy for treatment for any kind of illnesses, for acute diseases, for chronic illnesses, for difficult cases, for intractable cases, any type of cases. Any patient can flock to you and you can deal with the patient directly without any difficulty.
Great,
So
great.
that is the best part of India, and we Indians are really very fortunate. For that order, I would really congratulate one and every homeopath all over the world, the homeopathic fraternity all over the world, because we are the luckiest peoples that God has given us to do some work for the suffering humanity. And in the last 40 years, that whatever experience that I have gained, I have seen that one life is also insufficient for the whole work of homeopathy to be done. We are really fortunate that Hahnemann in his one life has given such a big that we last 40, 60 years are unable to comprehend everything and work thoroughly and totally with it. If you see the rubrics, the type of rubrics he has designed at that juncture, that he could know what is having vesicle in the sclera. How did he get that? We are getting patient vesicles in the sclera. We are having rubrics where we see that asthma or difficulty in breathing better by lying on the abdomen or better by keeping the hands. How did he get all these things? Today we are giving that the same thing today also. What has been discussed, what has been proved 250 years before is still stands high and true. That is the best part of homeopathy. That is the fundamental foundation of homeopathy. That is why I congratulate each and every homeopath, because you are totally a different sect in the field of healing. We are healers. There is a difference between treatment and healing. Treatment is just treating the disease. We are not treating the disease. We are healing a person. We are taking a holistic approach and healing the whole person, wherein the whole system of the body is synchronized, is running very smoothly. We are not keeping the patient lingering on medicine or making them to be dependent on medicine. After some period of time, you see that the patient is off on the medicine. It may be hypothyroid, it may be acidity, it may be anything. So we are not keeping the people lingering on medicine, and that is why we are more of healers rather than treating diseases or treating the symptoms. So
So,
now
and
coming,
you,
yes,
you were in Greece for the 4 years, right?
pardon me.
You were in Greece for the 4 years, right?
Yes, 1996 to 2001, five years. I was a direct disciple with George Vitulkas.
Yeah. Can you please explain what was your experience for there?
The experience with George was very good in the way. Why? Because I was battling last 40 years in India and trying to get the basic fundamental knowledge about homeopathy, how to treat. Because at that time, when I passed out in 1979 from Pune College, homeopathy was very much not known among the people, nor it was very much unaware. People were unaware, nor in the colleges we were taught homeopathy to what better extent today it is taught. And I had attended many seminars in Bombay as well as anywhere in India. I could not go out of India at that time, but I was not getting the real understanding of how to go into the case and what to treat in the case. It was the first visit of George Vitulkas in Bombay when I attended his seminar, and I saw cases taken by him live among 2000 delegates, where a kidney failure patient was brought and he was having severe nausea, vomiting. His creatinine was very high, urea was very high. He took the case, he gave the remedy colchicum, and every 24 hours, next day morning he was called. It was a 3-day seminar, and third day the patient was discharged from the hospital eating well food. It was unbelievable, for me at least. Because what we were doing was we were taking the chronic symptoms of the case along with the acute symptoms. He said that is the wrong strategy. You have to change the strategy. He has come with an acute over a chronic situation. So what was that acute? Severe nausea, could not stand even the taste or the smell of food. Looking at the food is very much bad. He could not sleep. He was very much so. Immediately Cocculus gave him a relief, and now he said you can treat his chronic situation, which is the CRF. So this was something different, the layers that he had taught us. And he taught, I am really very much grateful to Vitulkas, because the way he taught was not keeping anything in hand. We had a lot of live cases with him where we could see what are the detailing of the case, what is the upper layer, what is the next layer, and that is where we are failing. We are mixing things. What we have seen, Hahnemann has given as sulfur calcarea lycopodium. You say trio, but what we have taught in colleges is when we give sulfur, you give calcarea and then lyco. It's not so. It's not that way. When we say complement and supplement, it is not so that after giving sulfur, you have to give belladonna. You have to have those symptoms following one after another. And if your remedy is correct, you see that a sulfur, which was a hot patient, has turned over into a calcarea patient where he becomes sweat, he becomes very much chilly. And from there, he goes into lycopodium where he has clear symptoms or peculiar symptoms of lycopodium. That is the time you have to interpolate lycopodium. So it is the judgment at what juncture the patient is showing you the symptomatology of the particular remedy. Patient is very much clear. It is we as homeopaths unable to understand the signs and symptoms what the patient is giving you, the way he is narrating you. He is saying something, you have to look into the eyes, and that is why it is called as art. Science has been already given by Hahnemann in a very good way, which has not changed last 200 years. The Materia Medica is the same, the rubrics are the same. We have fantastic rubrics. I have a patient who had piles, who was suffering from piles. She had visited to different, and he could say that the single modality was better by walking. And you have only one remedy in that, and that remedy cured her. So if you go to the rubrics, if you see your rubrics with single remedy are unbelievable. Materia Medica is the final authority. So analysis followed by evaluation. How will you evaluate a case? What is that I have to treat in a case? Patient has come with a depression. Patient says, I am stressful. But what is the stress? It is the stress. What has the stress caused you? The stress followed by the reaction of the body. Finally, what is the reaction? Like simple children come with, they drink cold drinks or they drink ice cream. Some go with asthma, some go with tonsillitis, some go with coryza. So the stimulant is the same, but the reaction is different. We have different remedies for different reactions. We have to find that and judge that and correlate that. That correlation is an art. And that learning has to be done through Materia Medica as well as through rubrics. And that is the line of treatment and learning that Vitulkas has given us. And after that, we have seen a very different change in our prescriptions. And we have seen that we can treat retinitis pigmentosa, we can treat everything what is there, but in our limitations. There are limitations, but we can treat them.
Okay.
Unbelievable cases he had, and unbelievable treatment we can give.
Thank
So
you.
coming to the point.
Do you have any presentation for sharing?
Pardon me?
Do you have any presentation for screen share or something?
No. I just talk.
Oh, it's
Because yesterday in the afternoon they told me, and it was very difficult.
Yeah. No. I just asked that your talking is a little bit impressive. Yeah, please.
So coming to today's topic, I say that homeopathy is the best of all. Whatever 40 years I have seen, I have done my allopathic practice. I had my hospital also. I have gone through my teachings and my learning from the college years in an homeopathic allopathic hospital. I was working in BJ Medical College during my learning phase of in the Pune College, because there was nothing much teaching in the college. So I had joined BJ Medical College. There all my teaching and training had been done. My teachers were allopaths. I have been thoroughly learned a clinical way, more of a clinical practice. The best of my teachers were all the allopaths, and I could get the clinical knowledge from them, but the application of clinics to the patient in the homeopathic way was done by Vitulkas. So what is need of the hour is, as homeopathy has not changed, the provings have not changed, the symptom scenario has not changed, the medicine remain the world over the same. What is pulsatilla in India, in Sholapur, the same is the pulsatilla in Chile or in Germany or in USA. Medicines have not changed. There are no iatrogenic diseases. There is no, what we can say, resistant to any disease. What is the need of the hour? It is basically the need of quality education, which is very, very important, which we suffered very badly, and still the colleges are suffering from a good basic fundamental education. Apart from that, the next part which comes is clinical training. No clinical training is available, at least what I have seen in Maharashtra, my state. There is hardly any clinical training which is given to the students or imparted to the students in 5 years of their whole of learning. hardly they see 50 or 100 real cases which are treated with homeopathy. It's a really a difficult part, but we have to speak. Whatever lacunas we are having, we should not feel ashamed of talking about the lacuna. Unless we know our lacunas, we cannot rectify them. And we have to rectify that. It's very difficult to see a single case. It's all paper cases that has been done. And those are the cases that are presented. And this is how the colleges are running, which is really a very difficult part from homeopathy. Then what should be done? One, good teaching, good clinical knowledge. Third is creating an awareness among the general public. It is a simple man's medicine. Homeopathy is simple man's medicine. Why Calcutta is flourishing today with homeopathy? Because every simple individual, a common man, can flock in a homeopathic shop or a homeopathic doctor and take for day to day. We should not be cancer specialist. I don't want to be a cancer specialist, but I will be a doctor for general people. Because general 80% of the disease are general and regular diseases: acidity, constipation, piles, fissure, fistula, recurrent colds, recurrent tonsillitis, ear discharges, headaches. What you name them and you are there. Why you need to treat something which is difficult? Leave them for some time. And if our students are made to learn and understand these simple 80% of diseases to be cured, mass will turn to you. We have to be for the masses. What we see, Gandhiji, how could Gandhiji bring out the freedom? It was a mass movement. We don't want the government at finally has to understand the people. It's the people who will make them understand that we need this system to be inculcated in this our faculty of health. We don't have to fight. We are not competitors of anybody, nor we are having grudge for anybody. We don't want to have any competition with anybody. But what we are, we have to do the best of what we are. And if we do our best, I say, from my experience, that we can treat 80% of the regular disease symptoms that we are getting. It may be children, it may be, because what is best of homeopathy is you are master of all. You can treat any system. You can treat the brain, you can treat the hair, you can treat the eye, you can treat the ENT, you can treat the nose, you can treat the respiratory system. Now we have seen in COVID, we have done a lot of work in COVID, in the first wave also, in the second wave also. What is not treatable in homeopathy? Everything is treatable, provided you should know your limitations also. You should know whether the patient is going into complications. At that juncture, you should give them that right direction of what he should do next. If you can do that, if you can create a mass movement, I think homeopathy will be the world's best 21st century medicine. It has life diseases, lifestyle diseases, it has psychosomatic diseases, it has skin diseases. Nothing beats in skin diseases. Psoriasis, lichen planus, what you want, you have everything in homeopathy. You cannot say anything. Non-healing wounds, nothing, you can say no to anybody. Everything is there. So what I urge to the whole world, that we should create this new generation in a direction where they should get confidence, clarity of this basic best system of healing. All the seniors, even Mahatma Gandhi said, it is so economical, highly economical. Nothing can beat economics of homeopathy. In 20 rupees, we have treated corona. One dose of aconite has treated corona, where lakhs of people, lakhs of rupees have been taken. So nothing, it can be given in villages, it can be given in rural areas, it can be given in urban areas. Where it cannot work, it will work anywhere, provided you should have that vision, you should have that capacity, you should have that understanding. That understanding and capacity only will be done when we, the seniors, should treat or should educate our coming generation in a very good way. So we need to sit and we need to come to a common point. The basic fundamental teaching should be common. We have various schools that are coming up. There are various armamentariums in our system. All systems are good, All various schools are good, but the basic fundamental has to be there. You first make the student learn the basic fundamentals, which is the Hahnemannian principle, totality of symptomatology. Then you can use the application of mind symptom. Then you can use the application of protocols. Then these are different. They have to be applied as per the case comes in. Protocol cannot be used for every case. Mind cannot be used for every case. So you have to have those all armamentariums into you.
Yes.
The student should learn that, but that are secondaries. The primary is the basic fundamental foundation that Hahnemann has given you. If
Okay.
that is very much clarified to our students, I don't think we have to look back. We have to tell anybody, take homeopathy. You don't have to urge the government. And see, we have seen in this, it is very sorrowful state to say that we homeopaths have been pushed down away from treating people by the government.
Okay.
That was the very sorrowful part, though we could do much more better than what we have done. So this is the way only we can make homeopathy best. It should be a mass movement. For mass movement, we should train our students so clearly that 80% of the today's scenario of disease, which are treatable by homeopathy, should be treated very well.
Thank you, doctor. Thank you, doctor. Thank you. Nice presentation.
And I am very much thankful to all the patrons and head of IFHP to give me this.
I will come to point. I will come to you once again after the discussion with the third panelist, Dr. Amir Nasir Malik from Pakistan. I'll come to you once again, sir. Thank you, sir.
Thank you. Thank you. Thank you. Thank you.
Dr. Amir Nasir Malik from Pakistan is an ambassador of health and humanity, IRAWA, United Kingdom, OPS cabinet member, BLS, King University, UK, and American Heart Foundation, USA, MS scholarship from Mountain William University, USA, NICE member, National Academy of Young Scientists on Ifph panel, MSc Biochemistry, Ravi and Punjab. Okay, he completed MSc Biochemistry. After that, he completed his a homeopathy degree. And he is the first UAE-based homeopathic Pakistan doctor. And so I would like to welcome Dr. Amir Nasir Malik on behalf of IFPH. I would like to welcome once again. Thank you, doctor. Please, Dr. Amir.
Hello, greetings and good afternoon. And first of all, grand thanks to Honorable IFPH and our creators and lovers, Honorable Sir Firoz Khan, Honorable Dr. Shaji Khudiyat, Sir Manoj, Honorable Dr. Sir Manoj, Sir Dr. Ismail Said. I'm thankful to you, all of you. You are the king and the honors and the creators and the lovers of IFPH who create and continue the historical effort of our father, Dr. Frederick Samuel Hahnemann. First of all, a grand thanks to Sir giving me a chance to come on your grand platform. I am thankful to you, first of all. And second, Sir, today's topic is very interesting. That what should we do to become a best of number one, a good system of medicine in the world? See, first thing I have to told about, kindly see the history. Our father of homeopathic science, Dr. Frederick Samuel Hahnemann, was basically allopathic MBBS doctor. He is not satisfied with this system of medicine completely, because the very important thing is that the word cure, to get healed after the ailment, is never exist in allopathic. And this is the reason why he have had a great aversion in his heart, and he's searching for a new kind of system which have the values to heal, to treat, and the final thing to get cure, which in allopathic system of medicine does not exist. And this is very important for us always. And I believe every homeopathic doctor life is very little to understand this big science, the homeopathic science. And I first of all salute after Dr. Frederick Samuel Hahnemann that historical effort to continue studies on the homeopathic, to continue study research work exists then in India, then in UK, and then in America. In Pakistan, I'm sorry to say, we have no research center still regarding for the homeopathic doctors. So we want We must improve the education level and must follow the our India and Germany and London and USA to what to do to improve the education level in homeopathic. Very important. Second thing which I feels terribly, that is the general awareness what is the homeopathic medicine system is, what is when, where and how homeopathic science can help to a layman, and especially when the peoples don't know that in the chronic ailment and either in normal ailment, acute ailment, the homeopathic medicines can be used as an SOS treatment. Nobody believes this. They believe if we're having some emergency, we have to rush to the hospital. Even they don't think that the homeopathic science can help them to get rid of chronic ailments. We can treat the cancer, we can treat the tumors, we can treat the brain tumors, the cyst, the PCOS. They don't have basic common general awareness what is homeopathic and when and where they can help them. As I'm sharing my student life, when I'm studying BSc, doing chemistry, I am studying zoology, I'm studying biology, botany. Would you believe all of my teachers, which are PhD in organic chemistry, in zoology, in botany, whenever they teach me and they said, look, this is potassium cyanide, this is cyanide. So I told my teacher, sir, this is our medicine. So they just become shocked. How it is possible? You are saying that you have a medicine from cyanide, you have a medicine from the radioactive isotopes, you have the medicine from arsenic. So when I see the periodic table, I told my teacher, sir, look, see, accept the synthetic elements. All the elements in the periodic tables are our medicines. They are shocked. He is PhD in organic chemistry. My zoology sir, when teach me sepia, I told them, sir, there's a medicine from sepia for the females. So they laughed and said, what you are talking about? So I told them, sir, please, homeopathic science is working on a very large scale. But what I believe, the common general awareness is not available. We use social efforts as much as possible. We give the general common sense to the layman where he have to go when he is having the history of stones in his or her kidney, when he is having the arterial blockage, when he is having a brain tumor, when the people get know the they are suffering from brain tumor, they have only one thinking their mind thought is that we have to go for the chemo. Now this is the point, where should the government help the pupils? Where should government tell them, give them the general awareness, as there is the general awareness is available as in form of Panadol. We can see the billions of ads of Panadol, but we cannot see the one single ad to save the humans when the where homeopathic science can give them new life, a new hope. No one is doing this effort. This is the reason I, whenever I see Ifph and the such platforms, I don't see before, which are working so good, which are creating so many helping material to the humanity. And this is the historical effort that Ifph is making in the world. And when I see that the peoples don't know, after having the chronic ailments and rejected from the chemotherapy, the those departments who told them that we are sorry, we cannot help you, where the hope is that they can get a new life, a treatment. And believe me, this is where, when the allopathic surrenders, from that stage the homeopathic starts. And this is the effort we should continue in this direction, that we have to promote the homeopathic concepts, medicines, systems, details, and to the common pupils. So I hope by these kind of efforts will help us and lead us to success, which homeopathic science deserve. We never deserve this thing that you told, that the homeopathic is a pseudoscience. As Wikipedia mention us, this is a pseudoscience. I totally protest this concept. We are not pseudo. We are the 100% right. the immunity system, we boost the immunity system, this COVID-19 crisis, and give the understanding of vaccine to the pupils. Now they rush to save their life for vaccine. They have the only hope that vaccine is the solution. So I always ask all those peoples, all those departments, all those health departments and countries who deny the homeopathic science value, that if you agreed the beneficial effects of vaccines, so why are you denying us the homeopathic science who worked before Alexander Fleming, Louis Pasteur, who gave the vaccine to the world? The first vaccine to the world is given is alpha penicillin, then alpha and beta penicillin in 1796. But our father of homeopathic, Dr. Frederick Samuel Hahnemann, in 1755, give the homeopathic medicine which are prepared same as the vaccines are prepared. Now the point of conflict or discussion is that then why they reject us, neglect us, as they believe vaccine is effective, then why not homeopathic medicines which are semi-vaccines? There is same way you in what is in allopathic, you take the virus or bacteria, you kill them in predominant state and will be re-inject into the plasma. This is called vaccine. So what is the homeopathic science do? They take the king cobra venom, they take the cuttlefish ink, they take the potassium cyanide, and they titrate it. And titration is the same way of vaccine. When they kill that the virus or bacteria in predominant state, it is also a kind of titration. So my question to those health departments who deny us, they should reply us scientifically. Why are you screwing us? Why you are pushing us, giving us the second number in the world and giving us a low grade? You should appreciate the science who is helping the humanity in the right way, who is not suppressing the immune system. Unfortunately, at this time, I just want to know about the allopathic. They are giving third generation antibiotic. They are giving steroids. And still 40 years before, they have first generation antibiotic. Now the infants of 2-3 years, 2 months or 3 months, they are taking third generation antibiotic and they are not getting recover or heal or cure. And then they go for the steroid. So I asked the allopathic doctors, did you suppress the immune system by creating the third generation antibiotic? Obviously, definitely, you destroy the immune system of the humans. We have a very strong immune system, and homeopathic science never suppress the system. Homeopathic medicines are centrifugal medicines. They take the things from inside to outside of the body. Silicea, the sulfur, they all are centrifugal remedies. So whenever the homeopathic science come, we salute our homeopathic science, our father, and our IFPH panel, and our historical efforts. And I will not take more time. I know it's a
No
time
issue.
for all doctors, and I'm thankful to all of our creators, lovers, doctors, all the kings. I'm lot of bundle of thanks to you and bundle of praise for you, sir.
Thank
God
you.
bless
Thank you.
you.
Thank you.
God bless
Thank
you.
you. Please be with us. Please be with us for the next 10 to 15 minutes for a small discussion. We have to wind up our session by Indian time 9:30 today. Within 10 to 15 minutes, because there is another meeting coming on. But for the last 3 days, our president, the Dr. Ismail said, done a very good presentation, very good three presentation. The first presentation was done in clinical experiences for his cancer treatment, and the second presentation was with infertility treatment, and the third presentation was with Down symptom treatment. And he completed his 50 years of service in homeopathic clinical field. So I would like to show a small, give a small momentum to him. So I would like to welcome our three panelists to say a small word about Dr. Ismail Said, sir. So I would like to start from Dr. Iris von Hosten from Chile. Please, ma'am. Dr. Iris, yeah.
So I did not understand what, because I cannot talk about Dr. Ismail Said.
Yeah, the thing is that he's the president of International Forum for Promoting Homeopathy. He completed
Is
his 50 years experience, 50 years of his services in homeopathic field. The main thing for his the good quality is that his courage and consistency and commitment towards homeopathy fraternity. That's it. And the last 3 days, he completed his presentation in the cancer treatment and infertility treatment and the Down symptom treatment. That's it. Okay. So that's it.
I think it's what also this 50 years of clinical experience and the previous exposures showed that homeopathy is an entire health system and we can treat anything. Yeah, this is the important point. But the big part is why are we not all the same? Is the comprehension of it.
My point is that why I ask you, why I put it in your word is that as far as your presentation, the third slide was with it start from Ayurveda, it till ended up with the UN. No, it start from the BC 3000 years back and till it ended up with the United Nations. And for the last 50 years, for the last 50 to 100 years, the complete system was collapsed. Am I right? For the last 50 to 100 years. So the main thing is that, and especially our today's topic, what needs to be done to become homeopathy become the #1 medicine in the world. So as far as my understanding, the lot of homeopathic doctors doesn't have more courage to treat the patients. Why I put this paper to Dr. Ismail said, as far as in Kerala, right now in India, the Kerala is one of the #1 state in India to well diverse in homeopathy fraternity. So the courage of Dr. Ismail said is something different. He can treat any patient with good courage. So what is your advice to the homeopathic fraternity?
I think that the courage needs to be sustained by very good clinical knowledge. I have been working for 10 years in ICUs, helping people get off ventilators. You can do this if you are a good clinical doctor after being a homeopath. I think this is the first thing. You need to be a good physician, understand very well the physiology of the human body, and really get into also the new knowledge the science, the conventional science give us. Use it with the comprehension of the vibrational state the person is in, because this way I can be much more accurate in frequency and potency and in remedy selection. It has to be taken in account, and also work together with the conventional medicine, because we need a ventilator, we need oxygen. Thank you for having it. But then it stabilizes the person, but it does not cure. We all know that. But we have to have the courage to really work together and not to be separated. And this way elevate the nowadays medicine and take an account to create a change of paradigm, that the nowadays medicine has a huge knowledge about cell function, immune system, which we didn't have the last 100 years. But use this knowledge as a homeopath in our benefits and integrate it. And then being the leading doctor of a team. This is because we value the power which is beyond the cell structure, is the vital impulse, and give this a real clinical space. In this way, we could work in the hospital in each unit and together with the conventional medicine. I think this we need homeopaths which are really good clinical trained, which are really good in internal medicine, which keep up with the knowledge modern science provides, and taking this in account, get very good homeopathic training. Today, we need to integrate the both columns.
Thank you. Thank you, Dr. Iris. I'll come to you once again. Dr. Hiralal, regarding this subject, what's your opinion about that?
Sir, as I told you, I have been a student and trying to find the best stalwarts in homeopathy all over the world. And in that juncture, I found Vitulkas. It was a long desire to meet Dr. Seth, Ismail Seth, Dr. Mansoor Ali. They are all from Kerala. I was in Maharashtra. It was very difficult to have any chance of going to Kerala. February 2020, they had a cancer seminar in Cochin, and I was one of the presenters there for my cancer paper, and that was the time I had met Dr. Ismail Seth. His son was one of the coordinators. As he was very much busy, I could only meet. I don't feel that he would be remembering me because there were a lot of delegates who came, but that was the first time I had his darshan. And I saw at this age also, he was so jubilant, energetic, passionate in the working style. He was one of the key, what we can say, the central pillar of the Cochin cancer seminar. The way it was conducted, the way it was done, it was unbelievably beautiful. Vinu Krishnan was the student, one of my students who had come to Solapur to learn the Vitulka system. And because of him, I was motivated to come to Kerala. It was my long dream also. And during that visit, I had visited the Kottayam Mental Health Institute. I had met Dr. Sridharan, Dr. Muralidharan. And so I had a desire to see the institute, how it works. And it was a real happiness when I saw the institutes having 300 to 400 OPDs in their, at a place which was away from Kottayam in Kerala. It was a very small place, a village there. So it was just beautiful. Why not that scenario can be done in every part of the world? That was the question. And that is what I'm saying, that it can be done everywhere. When Kottayam, Kerala, a small village, the mental health institute is having 500 patients per day, non-stop. Why not we can do here? Everything it is possible. Not only, this is one part. Now we have come to another part. Now there was an advertisement for Liga, which is there in Turkey, September. They are also saying of agro-homeopathy and veterinary homeopathy. Why not? The homeopathic syllabus is prepared so that we can prepare homeopaths for veterinary homeopathy and agro-homeopathy. It will be a total different chapter. The education from human science has also to go to veterinary science as well as agro science. Where people, urban students, rural students who are coming, they can go for homeo agriculture syllabus. We have to do all those things.
My point is that, as far as I know, Dr. Ismail said that his main quality is that because the second stage or the third stage of cancer patient, he treated very well. So the normal homeopathic doctors, they are failed to for the courage is the reason. The main reason.
I will tell you that the courage will come from confidence. The courage will come from experience. Courage cannot be, you cannot get courage from anywhere else. You have to get courage of your own self, from your experience, from your confidence. And that is what he has done last 50 years. The way he is passionately working, the way he has been bringing out himself. When you start seeing few cases, if I treat today dengue fever, if I treat 5 dengue fevers, the 6th dengue fever I can treat very easily. If I treat one simple cancer, the second cancer will be more difficult to treat. The third, yesterday I attended his Down syndrome. I was there throughout Down syndrome. We saw how medorinum, we will be fearful of giving medorinum repeatedly. He gave medorinum repeatedly. How he showed where is the use of medorinum, what is the use of tuberculinum, what is the use of thuja, how Barata carb is different from calcarea carb. So this will come from experience. This will come, the experience will give you confidence, and the confidence will give you courage. They are following one after another. So, and for that, the basic fundamental education has to be very much clear, perfect, crystal clear. It should not be clear, but crystal clear. So
Thank you.
that is my urge. Then only you can prepare homeopaths. Like Dr. Ismail said, we have to follow him. We have to follow his understanding. We have to follow his passion for working, his zeal and dedication for this homeopathic science.
Thank you,
This
doctor.
is what we have to learn from him. And really, I was fortunate to meet him as his son during that. It was a long cherished desire which was fulfilled in 2020. Thank you very much.
Thank you.
And I really congratulate Dr. Ismail Said for his 50 years, more than 40 years, one tup. It's called as one tup. More than that, his service to the humanity, his service to homeopathy. We pray God for his more health, positive health, that we can get his understanding, learning, and his services for the suffering humanity. It is unbelievable, his service towards cancer or Down syndrome. The cases is narrated in the fetus part, unbelievable. Nobody will touch. I also cannot touch. But it is something, after learning from him, we get a confidence that I should also try for this. And he is very much open to make us understand. These, the other thing is very important is, the senior should be open to the juniors.
Correct.
I had been to many teachers before. They were teaching with closed hands. You cannot make your younger generation stronger if you keep your hands closed and teach them. If you give medicines without unknowingly, you give number 1, you give number 4, that cannot be happening. You have to have differential diagnosis of remedies. I have treated a case of dengue fever with pyrogen. Why did I give pyrogen? What happened to belladonna at that time? What happened to arsenic at that time? How did you differentiate one remedy to the other at that particular juncture is something that has to be taught, which will make our students clear, which will make our students confident. That is lacking very badly, very strongly in our practice.
That's why,
Differential diagnosis of remedies.
that's why right now more George Vidakos will come from India, right?
No, it's not that, not coming from India. It is what our basic education is lacking and what we have to rectify. That is what I mean to say.
Correct, correct. Thank you, doctor. Thank you. Thank you. Dr. Amir Malik, please
Yes, sir.
unmute yourself. Yeah. Yeah, Dr. Amir Malik.
Okay.
Yeah, please.
First of all, sir, I am thankful to Honorable Sir Dr. Ismail Said. He is our most of senior doctor, and the cases really have read and heard. It's few doctors, it's very true, have the courage to take the chronic cases. Actually, this is based on the education and experience. It is very important. I also in my life I have taken the most emergency SS cases of the brain tumors, of the kidney patients. We are having a 20 creatinine, and this is depend on the skills and education and practically the years of experience. So the most senior person, I agree with Dr. Honorable Hira Lal, who said that seniors must be open for the juniors. So they will be the next, the juniors will be next there where the seniors are. So when we're having Honorable Sir Dr. Ismail Said, sir, I'm first of all thankful to them who always help and introduce us a very good medicines, a very good way of treatment. And I know, I remember one of the hypothyroidism and hyperthyroidism. Both cases are taught me by Honorable Dr. Ismail Said. He told me, give this medicine, the fucus, for the hypo and for the hyper, the sulfur. So I remember that, sir. And I believe that to handle the chronic cases, we must trained our doctors. We must give them the basic line of action, how they take the case when then the patients come to the homeopathic doctors regarding by this hope that they can be healed or treat or cure by the homeopathic medicines. So we have to develop and promote the higher education level and give the SS training as the people don't have belief or don't have any idea that when they have the very high sugar, what should they do? So when the patients come to my clinic, I put to them gather, bring the glucometer, check the sugar level, and starting giving the homeopathic medicines. On my record, with the time 9 to 12 minutes, the sugar level gets down. So I told them, please see, if you take the allopathic medicine tablet, it will decline your sugar after 30 minutes because biotransformation of the allopathic medicine will take 25 to 30 minutes. It have to digest in stomach, then go to intestine, then go to platelets in liver, and from liver to platelets. Then it will be biotransformed, and that process will take 30 minutes. And in homeopathic science, how amazing! From the electric charge of the tongue, in just few microseconds, the medicine start working, the most fastest way of the world. As the allopathic believe this fastest way of the world, as when the people having heart attack, they give the NG-said nitroglycerin below the tongue. So they know this secret. And this secret is goes the credit by the Dr. Frederick Samuel Hahnemann, father of our homeopathic science, who used the medicine and the material of medicine. That is also very important. That is alcohol. Why alcohol? Because you know the aeroplanes, billions and trillions, the weight in tons, and the fuel is a volatile liquid. This is how the energy transferred from lower emission to higher emission. And this is the secret to boost the vital force. So anyway, this time we give the confidence to our homeopathic doctors by saying this, that you can treat the chronic patients, you can treat the chronic ailments, and you can treat the situation when it's known as SOS situation. We can help them.
Thank you, doctor. Thank you. Thank you very much, Dr. Amir Malik. Dr. Sidrakul, 1 minute, please.
Yes, Dr. Iris, Dr. Hirelal, and Dr. Amir Malik. I was listening very carefully about what they told. I made a note, but that within that I realized that one thing, the publicity and the awareness among the public is essential, because the Ayurveda and allopathy, they are doing the publicity. You can see even some Ayurvedic medicines also, some cough syrup and powders and etc. It is coming, that publicity. We are not having any publicity at all, even little bit. So it is the our that like that about that our they were telling about the paradigm shift. We must have to shift up to certain extent, and also we must have to educate even one every day, even one doctor. Even 15,000 doctors are in Kerala. If one doctor, even one patient, if you may give what is homeopathy and little bit, then definitely it will have a great effect in the public, that they will get confidence on us. So thank you very much.
Thank you, doctor. Thank you, doctor. I would like to give 1 more minute and to Dr. Iris. Dr. Iris, 1 minute, please. Final talk.
No, I just want to say thank you for all the participants, and I think this getting together the ideas, the aspects of education, of courage in homeopathic treatment, and to share the older homeopaths proactively the younger ones, that you can dare to trust the homeopathic treatment when you really comprehend the energetical state of your patients. I think this is very important. I think after this round of getting thoughts together, we have to get to a second level to write it down and make it practical in education for the younger doctors. Thank you.
Lokmanya Gupta, 1 minute, please.
Yes, thanks a lot. The trio speakers, all the three speakers, gave a very good deliberation for homeopathy And the main things coming forward are that we should come together to share and care. This is my message for all. We should come together and forward to uplift our homeopathy. Thanks a lot.
Thank you, Doctor. Thank you. So I would like to wind up the session today. So I would like to call Dr. Ismail said his health is not good. Maybe, sir, can you come forward and say a word of thanks? Dr. Said, sir.
You are giving me that much punishment, eh? Yeah. Anyway, because due to my lumbar pain, no, I am laying down.
Oh my
That's why I have not shown my face, because I got some damage of my 4 lumbar spine. Except 5 is there, but for 2 is escape. 1, 3, 4, 5. All compressed. 2 ways compressed fracture. Otherwise, it is compressed. The 4th one, it was compressed. I don't know how it was happened. Anyway, last week I got some severe pain, and now I am getting improvement with the pain, and I can't sit more time. I can't sit like that. And the homeopathy hospital also having the good practice now, and the patients are coming from very far, so I have to sit there. Today also I went to my hospital by 10 o'clock and came back by 5:30. That's what the thing is going on like that. After that, I thought that I can lie down in the bed so I can attend this one. Anyway, you are given me with a good patronage and good words. I'm very much thankful to you and very much obliged to you all. And inshallah, I will express my experience after some few weeks later. 1, 2, 3 like that. 1, 2, 3 like that. We have some of the experience we have. I should that means spare to the others to encourage the homeopathy. Then only their mind will come up with the students and youngsters. I'm always like that. I'm encouraging my students always. Suppose I'm getting any experience one time, I will recheck, and fourth check, I'll deliver to my students and my juniors. That's my thought and my fashion. That's why most of my students are respecting me. Most of my students are loving me so far. I remember at the time of my retirement, so many people are coming from here and there. When say health secretary, finance secretary, and 3-4 MPs, 2 MLAs, and ministers, all came for my center of farewell. So that moment was very much touched to me in the heart. So that I learned more with homeopathy. I learned, deliver my knowledge to others. It's my motivation. Inshallah, I will do it. I will do it till my death, until my death. So here, my duty to say out of to all who are attended here and very keenly attended this one, given them their own opinions very sincerely. Once more, under the Ifph as a president, I am giving out of time to all. Thanks to all. Thank you very much.
Thank you, Doctor. Thank you very much. So we would like to wind up today's session.
Yeah.
Our aim is one world, one health, win with homeopathy. Thank you. Thank you, Doctor.